From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Schiffman. The COVID-19 pandemic crisis has many individuals and families searching for vital services in their communities. A resource portal that's been in the works for the past 3 years is just launched, just in time to provide the access to information, resources, and referrals. This new online community resource database for the western part of the state is called 413CARES. And here to talk about this new initiative is Jessica Collins, the Executive Director at the Public Health Institute of Western Massachusetts. Thanks for coming on the program.
Thank you for having me.
So first, let's start with what is the Public Health Institute of Western Massachusetts and what kind of work do you do there?
The Public Health Institute of Western Mass is based in Springfield, and we do 3 major things. We do research and evaluation, coalition building, and health policy development for specific public health issues in our region.
So what is your background in public health organizing?
I've been working at public health for almost 30 years and have been with the Public Health Institute of Western Mass for about 12. And really what I love to bring to this work is trying to equal the playing field, so that everyone has what they need to lead a healthy life.
And why did you decide to undertake a project like 413CARES?
We took this on because, quite frankly, we were hearing from stakeholders in our region that an online resource database like 413CARES was very much needed. It was needed for our residents, it was needed for community-based organizations, as well as the healthcare sector.
So what does this initiative address then?
The 413cares.org online resource database helps different sectors bridge to each other. So, for example, if a primary care physician is taking care of someone based on their medical needs, and also a social service agency is taking care of the same person based on social needs, it historically is so that they don't necessarily know what the other is doing. And so then a person doesn't have what we call sort of holistic wraparound services. And so having an online resource database like 413CARES really offers the people who are trying to support residents in our region to understand what all the resources are and also connect to other people.
So is it a focus just on health?
Well, health in the broadest sense of the term. So It's social health needs, it has food resources, it has employment resources, transportation, utilities, healthcare, behavioral health, daycare, everything you could imagine that determines how well someone can live.
I was going to say, yeah, like if you're lacking one of those services in your community, it probably does impact your health in some form or fashion. Yes. Do other communities in the region have similar types of resources like this, a directory like this?
Yes, they do. And I'd like to give a shout out to our friends up in Hampshire and Franklin County who have a similar resource database called Look for Help. We also have learned a great deal from Worcester County that has a similar resource database called Community Help. And then, of course, there are statewide efforts like United Way's 211 for years, which is a little bit different. And also there is one called Mass Thrive, which is led out of some healthcare institutions in the Boston area.
You know, when I was looking at your website, prepping for this segment here, the first thing I thought was 211 with the United Way, and I understand that's been around for a while now. So what made you guys think that you needed a separate entity, a separate directory, and maybe like explain to me what sets the two apart?
Yes, thank you. Well, as you know, technology is changing just in lightning speeds. And so what is created one week might be outdone and surpassed in the next. I think that the 413CARES is a complement to 211. 211 is often utilized by phone, obviously. And what we were understanding from folks in our region is that an online tool would be very helpful. 413CARES also adds an additional element that 211 does not have, which is a closed referral mechanism. So if you're sitting in one institution and you want to send your client to another, you can do that through the 413 CARES database.
So this is not necessarily just for someone like me, but it's also for all of those agencies that work with 413.
Yeah, so basically 413 CARES is for residents like you and I if we're looking for something for ourselves or a family member, but it's also for folks who work in or at a social service agency or a healthcare institution. So yes, you're correct. It's public facing and it's for all of us.
Okay, and then so let's talk about some of those community partners. Who are they?
Yes, so I really would like to name all of them because they are very important to us. Bay State Health, Behavioral Health Network, Care Alliance of Western Massachusetts, Caring Health Center, the Food Bank of Western Mass, Greater Springfield Senior Services, Human Service Forum, ServiceNet, Springfield Central Library, Springfield Office of Housing, Square One, Sunshine Village, Western Mass Network to End Homelessness, and West Mass Elder Care. And I just feel like it's important to call them all out because you can see the diversity of the social service sectors represented and the types of groups or populations that they might be serving.
And this was, I understand, 3 years in the making. So you're going to all of these different agencies, these organizations. What was the reaction like when you initially started this?
Well, again, we had done an assessment several years ago where we heard from the social service organizations and the healthcare institutions saying we need something like this. And we knew nationally that this type of software was being developed. This technology already existed in other places in the country. So people were very excited to pick their own the software system that they thought would best service, and they picked this software system, which is called Aunt Bertha. So the national company is called Aunt Bertha, and then we rebranded our local effort to be 413 CARES.
Okay, all right. Well, I want to talk more about all those different agencies coming up here after the break. You're watching 22 News in Focus. We're back here at 22 News in Focus, and today we are talking with Jessica Collins from the Public Health Institute of Western Massachusetts about a new online public resource. It's called 413 CARES. And if people are just joining us right now, maybe they tuned in just a little bit late, a brief overview of 413 CARES for me, please. Go ahead. Tell me a little bit about 413 CARES.
So 413 CARES is an online resource database that is public facing, and it's available for people to look up healthcare services, social services, just basic human needs. And you can format their own searches online.
Gotcha. Yeah, I know we're dealing with a little bit of delay. I know. We're getting used to Zoom, right? Let's talk about this though, because you mentioned that you had kind of surveyed the community to find out, what services were needed and what service providers were looking to that needed as well. So, maybe walk me through maybe 2 or 3 of those services that apply to this.
Okay. So what we learned from our assessment is that for folks who are in a healthcare setting, they're not just simply troubleshooting medical care and services for people that they work with, but they're also trying to figure out social needs as well. For example, food access or housing. So having an online resource database like 413 CARES enables them with their patient to be able to go on the website, to look up food services, for example, that might be close to them in their neighborhood. They can then provide information about what time of day is the food service open. Do they have multilingual staff who could be helpful if appropriate, etc. So that's one example. For folks in a social service agency, they sometimes know the social services they provide. For example, if you're a housing agency, but they don't always know about other social needs. And of course, for people who are experiencing one social deprivation like housing, they're more often than not experiencing food security, for example. So providing this type of online resource database just gives more people more information.
And as we chat here, we're showing some screenshots of the website, and it is pretty interactive and easy to use too, and different languages as well, right?
Yes, it does. It has, software that's built in for many, many different languages, and we hope people are aware of that so that they can set it up in the best way that helps them.
So who are you guys focused in on? What demographic?
Well, it's a resource database for Western Mass, so the 413 Care region, so for all counties. We really are working to try to get organizations to, quote, claim their sites. And then what happens is the organizations themselves populate the site with the information and the services that they would like to provide. And those organizations, like I just said, are in all 4 counties.
Explain that to me, claim the site.
So, for example, if you are an organization like the Food Bank of Western Mass, they could, quote, claim their site. And so they would have a link through the 413 CARES database, and they could list all of their programs. They could list their distribution routes for emergency food. They could have their brown bag meal site plan up. They could have the locations of all their member pantries, what hours, the multilingual staffing, etc. So they themselves populate what information they want to have for their own organization.
And if I'm going to the website, walk me through how I search for the resources that I need.
Okay, so if you go to the website, there are multiple headings at the top in green that you'll see: food, transportation, early education and care, etc. So depending on what you need, it's fairly straightforward. You click on the topic, and then from there you can enter in an address. You can enter in what type of food service you're potentially looking for. It's hopefully straightforward. It's been tested, but I'm looking at, so if you were looking for food, you could, for example, click on that apple that's there.
Perfect.
Yeah.
That's awesome. Okay, so once we do get maybe we want food, for example, and it puts us to the food bank, what's the next step? Is there like an application process, or are we working now directly with the food bank?
Well, you could potentially work with the food bank, or you could put in the next level of information, which might be, for example, your zip code. And so if you put in your zip code, then a GIS map would pop up and you could see what are the, for example, food pantries in your neighborhood that would be available to you. And so the more information you put in, the narrower the information gets for you, so that you're able to pick exactly what would be most helpful for you or your family or your client.
And then I know people at home are thinking, okay, what's this going to cost me?
Yes, it's free. It's a free online resource database. Bay State Health has funded this. They understood it was what we needed in the region. And all of these other organizations that I listed off are providing staffing and updating their sites so that people in our region can have real-time, the best information as possible.
And I was going to ask, who maintains the site, but it sounds like that's really a collaboration then.
Yeah, great. That's a great question. So the organizations themselves that have claimed it need to update it in real time. Aunt Bertha, the national company, what they do, which is very helpful, is they actually verify the information before it gets allowed on the website. So every time an organization tries to claim, they have several security steps to actually make sure that that is a legitimate organization and a legitimate website. And we also at the Public Health Institute of Western Mass are updating the information.
Okay, great. All right, we're going to continue our conversation just after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about a new online public resource, 413 CARES, and Jessica Collins from the Public Health Institute of Western Massachusetts is joining us. Now, just before we went to break, you mentioned how all of the different organizations are vetted before they're actually able to claim a portion of the site. So that led me to this next question, and that is, this site can get bigger and bigger and bigger, more and more resources available. It's endless, really, right?
Well, that is a great question. I think at this point we are limited to 10 topic areas, but which you showed on the website before. But there are some other things that we are hoping to add, which we think are really important, which are assets. For example, things like our arts and culture organizations, things that people might not necessarily think of as service oriented. So we do, and we will incorporate as many as we possibly can. And we also want it to be about what people need. So we have to be able to be nimble and create services. We have to be able to create information about the services that people are asking for.
And in addition to providing resources to people, that website also helps provide and determine which services are in great need. So what is the data telling you about which services people are currently searching for?
So yes, that is another very helpful thing about this Aunt Bertha database. So we can track for example, what are the words that people are entering in? What are the most common search terms? We can track what are the services, the specific services people are clicking on. So far, we understand that people are mostly looking, not mostly, but more often than not, looking for housing and for food, which is not a big surprise, but it was very validating. We hope they're finding what they need. We also know that in the month of March, and similar to the month of April, we have about 1,800 searches that have already taken place, and we understand that will likely grow as we're getting more attention out there through mechanisms like this show.
So what about personal information? How is that personal information being used? Is it being shared?
Yeah, thank you for asking that. No, there's no personal information. The one thing that I mentioned to you, which is a closed referral, people can type in a name, but this is not collecting people's full name. It's not collecting birth dates. It's not collecting anything personal like that. And like I said before, if you choose to put in your zip code, that is basically unrelated to anything else about you. So there's no HIPAA concerns or anything like that.
And what about the search information as far as for all of your partner organizations? Are they able to use some of that search information to better their organizations and, make sure that they have the proper services available to the public?
Well, that's exactly what we're hoping, is that we can be able to give these reports back to them to say, look, this is what people were actually clicking on your website. These were the types of services people were looking at, and we're hoping that, yes, that would be very informative to these organizations. And if they're seeing a huge search rate in one area and not so much in others, they would obviously have to do their own analysis and strategic planning around, what this data is showing.
And for people in organizations that are looking for ways to support community organizations, how is that information helpful to them, or is it?
Well, I think that one of the goals of this in the first place was to be able to connect historically siloed organizations, like I shared with you before, people who work on housing, we're focused on housing. Now what this online resource database does is it brings different service organizations and expertise together so that people in our region can actually be cared for and supported and can do it themselves in a more holistic way.
What is health equity, and how can we fix that?
Health equity is a term, thank you for asking, it's an important question. Health equity is a term that's used to describe the idea of making sure that everyone is not just getting everything equally, but that people are getting what they need with regard to how much they need. And so what we see with health equity is that sometimes when you look at data, you can see that some specific populations are suffering more, from cardiovascular disease versus other populations. And so that might provide some insight to the fact that there needs to be more food resources or more opportunities for physical activity or more education about smoking. And so when you look at data through a health equity lens, it teases out specific populations that need more specific resources.
And that isn't something that's relatively new, is it? I mean, I know a lot of people like to say everything should be equal, and it's just that's not realistic if you really want to make an impact, right?
Yeah, I mean, for us in the public health sector, health equity, we've been talking about it for probably about 10 years.
Yeah.
And I think it is a better way of framing than to use the term equality, because people like you and I might not need as much as other folks that need more social services or more access.
And we've been talking a lot about COVID-19, obviously, in the midst of this pandemic. What type of information is on the site concerning that?
Yeah, and this is another really great thing about having a national software platform is they were very quickly able to create a specific COVID-19 website, part of our website. We have had more coalitions and networks reaching out to us to say, hey, can you please make sure this gets up on your COVID-19 resource link? And that has been tremendous because there are different needs now in this particular time than before. And so being able to be nimble in an online resource database like this is critical.
I was going to say, 3 years ago, you probably didn't think about COVID-19 when you're going to be launching this local site. All right, we're going to have the final words just after the break. You're watching 22 News in Focus. 22 News in Focus, and today we've been talking about 413CARES. It's a new online community resource database for Western Massachusetts residents. And I want to thank our guest, Jessica Collins, the Executive Director at the Public Health Institute of Western Massachusetts. Thanks for coming on the program.
Thank you.
And thank you for watching the program today. If you missed any of this, of course, you can watch it on our website at WWLP.com. From all of us here, have a good day.